now hear from Barbara Lowe Fisher, who's president of the National Vaccine Information Center. You're recognized.
Thank you, Mr. Chairman. My name is Barbara Lowe Fisher, and I am the president of the National Vaccine Information Center, formerly known as Dissatisfied Parents Together, which I co-founded in 1982 with parents whose children had been injured or died from the adverse effects of the DPT vaccine. Our nonprofit organization represents tens of thousands of Americans, including families affected by vaccine reactions, healthcare professionals, and parents. We're working to prevent vaccine injuries and deaths through public education and to institute safety and informed consent protections in vaccination programs. Some of us worked with Congress in the early 1980s in a bipartisan effort to help create and pass the historic National Childhood Vaccine Injury Act of 1986. One of our main goals was met in 1996 when a less reactive pertussis vaccine was licensed. I want to thank you, Representative Micah, for having the courage and the vision to hold this hearing. As you have heard, vaccine safety is an issue charged with emotion because whether death or disability is caused by a disease or by a vaccine, the pain is exactly the same. And when children are suffering and their parents are grieving for them, there are no words to make the pain go away. I think what's important at the end of the day is to acknowledge that we are all here because we love our children and we want to protect them from harm. And we need to find ways to protect them from vaccine injury and death while we create public health policies designed to protect them from the ravages of disease. There is no reason why we can't accomplish both of these goals if we embrace the principle that every child's life is important and no child is expendable. The National Vaccine Information Center has received hundreds of reports of injuries and deaths following hepatitis B vaccination. There's a clear pattern to hepatitis B vaccine reaction symptoms, just as there was a clear pattern associated with DPT vaccine reactions. But unlike DPT vaccine, where most symptoms usually occur within a few days of vaccination, hepatitis B vaccine reaction symptoms can take many days or weeks to develop and include fevers that come and go, open skin lesions and rashes, severe joint pain and head pain, loss of vision, muscle strength and memory, and crushing, debilitating fatigue, which leads to chronic disability. We have had reports of liver cancer developing in small children following hepatitis B vaccination. There are families with 2 or 3 members who have become disabled after hepatitis B shots. Tragically, for newborns and babies under 2 months of age, a hepatitis B vaccine reaction can end in death. When parents look to the medical literature for answers, they find few studies looking into hepatitis B vaccine reaction reports. None deal with newborns. Most of the studies look at vaccine efficacy, not vaccine safety. A 1994 study by the Institute of Medicine, mandated by Congress under the National Childhood Vaccine Injury Act, found that there have been no large controlled observational studies or clinical trials investigating clinical reports of arthritis, Guillain-Barré syndrome, transverse myelitis, optic neuritis, multiple sclerosis, and other central demyelinating disease, or sudden infant death syndrome after hepatitis B vaccination. What then will be the scientific criteria used to either award or deny children compensation for their hepatitis B vaccine-associated injuries under the Federal Vaccine Injury Compensation Program? Serious questions remain about the quality and quantity of the scientific evidence used by federal health agencies to license this vaccine for use in children, and in 1991 to recommend that all newborns receive their first dose just 12 hours after they take their first breath. Last Tuesday, I filed 2 detailed Freedom of Information Act requests with the FDA and CDC to make this information a matter of public record. We hope this will lead to better public understanding of current standards used to license this first recombinant DNA vaccine, and then recommend all newborn infants and children be required to use it. I will provide copies of what I received from the FDA and CDC to you, and I submit my FOIA requests as part of the record. Families with vaccine-injured children are trying to cope with the knowledge that they tried to do the right thing. They did what public health officials and doctors told them to do. Most of these children were exceptionally bright, healthy, and robust at the time of vaccination. They received a hepatitis B shot, and something went horribly wrong. In some cases, they were coerced into having more hepatitis B shots, even in the face of severe reactions, because the push for a 100% vaccination rate has all but eliminated the right to informed consent when it comes to vaccination in America. This information sheet on hepatitis B, produced by the Centers for Disease Control in compliance with safety provisions in the National Childhood Vaccine Injury Act, does not come close to meeting the informed part of informed consent. Parents who want to make educated hepatitis B vaccine decisions for their children often are threatened when they even ask to delay vaccination if the child is sick. The lack of informed consent protections in mass vaccination programs is leading to fear and mistrust of the whole vaccination system. Bottom line, what we are hearing parents tell us is, show us the science and give us a choice. So we come before you today to ask for, first, an investigation into Federal Health Agency licensing and policymaking standards applied to the recombinant hepatitis B vaccine. And second, consideration of special congressional appropriations to fund non-government, non-industry conducted scientific research to identify genetic and other high-risk factors for reacting to hepatitis B vaccine. And third, the institution of informed consent protections in current vaccine policies. Again, thank you, Chairman Micah and members of the committee, for demonstrating leadership by acknowledging these vaccine safety concerns, which is the first important step toward addressing them in a way that will save lives. You have listened, and we are very grateful.
I thank both of you for your testimony. Ms. Fisher, you just testified that you felt that the vaccine information sheets handed out on hepatitis B are inadequate as far as disclosing risks and benefits. What more can we do, or what more should we do, or what information should be included would be my first question. And then the second is, there are 16 states now that do allow sort of an opt-out. How would you go about changing that, since you have a state-to-state requirement?
Well, first, I'd just like to read that the mild problems that are listed on this are soreness at the injection site and mild to moderate fever. The only severe problems listed are serious allergic reaction, and it says very rare. There is no description here of the kinds of symptoms that we've heard today.
So that's all that's on there? It just, as far as severe, it...
Right. Is serious allergic reaction, which is, they say, very rare. And they describe serious allergic reaction as difficulty breathing, hoarseness, wheezing, hives, paleness, weakness, etc. That's a symptom of anaphylaxis. Now, anaphylaxis occurs within a very short time period after a vaccination is given. So the people who testified today that told you about these symptoms, they would be candidates for revaccination according to this vaccination sheet. And in fact, this is part of the problem. We have heard from so many people who are being forced and threatened that they have to go forward with hepatitis B vaccinations even after they've experienced fevers that come and go, skin lesions all over their body, severe joint pain, symptoms, autoimmune symptoms and neurological symptoms, and they're being ignored, and they're being, because there is this push for 100% vaccination rate, basically, these people are not being screened out. And they're not being given full information, and the doctors aren't being given full information about what to look for after a hepatitis B vaccination. I mean, the manufacturers, frankly, in their product insert have more of a description about some of the reactions that have been associated with the vaccine than this sheet. And what I'm concerned about is that this sheet was mandated under this compensation program. And we fought very hard for the parents who were involved in this creation of the system, of which I was one, fought very hard for the safety provisions. And one of the safety provisions was that parents would get proper benefit and risk information prior to vaccination so they would know how to make informed decisions, number one, and also so that they could monitor their children following vaccination for signs of reactions so that revaccination would not take place and more serious reactions would occur that would end in disability and death.